Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Every day, around 150 PYQs, we shall do the revision. And totally, there are 22,000 PYQs. If you take 10,000 PYQs in NEETPG, 6,000 PYQs in FMGE, and 6,000 PYQs in INICET, together 22,000 PYQs. Will take around 150 to 200 hours to do the revision of this entire set of the PYQs. I created them like a single liners along with the topic from which they have been asked, and it become easy for you to do the quick revision. I'll give you the PDF of these 22,000 PYQs. Very good to see 6 online classmates. Can you please punch? Is the voice loud and clear? Are the letters big enough for you or not? So please do comment in the comment box. So let's make the great beginning, Doctor. Yes. Tyson's glands. What type of glands are Tyson's glands? They are the holocrine glands. Once more, what are apocrine glands, merocrine glands, holocrine glands? What are the examples? You need to be very sure when it comes to the tomorrow's NEETPG. Fecal fistula. Fecal fistula at the umbilicus is because of what? So you should know it is the persistent vitello-intestinal duct that lead to the fecal fistula onto the umbilicus, which you should remember. From where do the ribs develop? So in the embryology, what are the paraxial mesenchymal derivatives? Ribs are derived basically from paraaxial mesenchyme is what you need to remember. From where does the pituitary develop? Pituitary develops from the Rathke's pouch. So once more, craniopharyngioma, how to recognize it on the imaging, everything you should know. Now, biceps jerk. Typically, what is the root value, doctor? C5, C6 is the biceps jerk. So whenever you take cervical spondylosis, the most common location for this cervical spondylosis is C5, C6. And how do you test that? You will do the biceps. Biceps is typically areflexic or decreased reflexes at the level of the lesion. And below the level of the lesion, there is an increased reflex. L3, everything will show increased jerk is what you need to remember. So, a very important thing that you should know is in the spinal cord, you have various levels of the spinal cord. So, suppose let us say it is C5, then you have the C6, then you have the C7, 8, T1, like that until you go to lumbar, let us say L1, L2, L3, etc. So whenever there is any lesion of the anterior horn cells at this level, then whatever the reflex which is supplied by them, that is biceps jerk is supplied by the C5 and C6, biceps jerk. So that become areflexic, And below the level of the lesion, whatever the jerks are there, like knee jerk is at the level of the L3, it becomes hyperreflexic. C8 and T1 are involved in the supinator jerk, etc. So they all will typically get increased. So at the level of the lesion, it will be areflexia. Below the level of the lesion, because of the loss of inhibition from the higher level corticospinal tract, there will be hyperreflexia. That is how you localize where is the lesion, and compression of the spinal cord is what you should remember. So now, doctor, coming back, angle of the humeral torsion is how much? So you should know these are all purely Bhatti items. रट्टा मारने वाला आइटम्स है 164 degrees, which is the carpal bone. She looks too pretty, try to catch her. She looks scaphoid, lunate, too pretty, triquetral, and pisiform. So it is the hamate. Try to catch her. Her is H is hamate. So proximal and distal rows of the carpal bones. So hamate is the carpal bone which has got a hook. It's called hamate hook. Capitate is the first carpal bone. Capitate is the first carpal bone to ossify, one of the favorite areas of the examiner. And the most commonly fractured carpal bone hota hai scaphoid, is the most commonly fractured carpal bone. And it is the pisiform that articulates with triquetral. She looks too pretty, right? Then try to catch her. So triquetral and pisiform articulate with each other. So when so many times you can see 2017 of FMGE, so many times when the examiner called for your knowledge on the carpal bone anatomy, you should not leave it at all, right, doctor? Now, the middle trunk of the brachial plexus, it is formed by the C7 is what you should know. And where do you get the regimental badge anesthesia? Yesterday also we discussed. Whenever axillary nerve injury is there, deltoid is the muscle which is paralyzed. That's the reason 15 to 90 degrees abduction is difficult. And there is a loss of sensation in the area of the regimental badge is what you should remember. Now, what is the function of supinator? Supinator is soup, just like you drink the soup. So, supinator enables the screwing movement. For screwing, you need to supinate, right? For unscrewing, you need to pronate. Unscrewing, you need to pronate. So, this supination, which is the thing which is involved at the time of screwing any nail or anything, then it is the supinator. So please remember, there are two muscles which help in supination. One is supinator, other is biceps brachii. This is the funda which you need to be very, very sure about, doctor. So let us become very clear about it. Supination of the forearm is because of two muscles. One is biceps brachii, one is biceps brachii, and the other one is supinator muscle. Supinator muscle is supplied by radial nerve, radial. So please don't forget radial nerve. Our biceps brachii is supplied by musculocutaneous nerve, musculocutaneous nerve. All right, now? So now, whenever you are supinating, supination means like soup, your palm is looking up, right? So, whenever you are flexing your elbow and supinating, then the biceps brachii will function. That is musculocutaneous. Whereas, if you extend your elbow and supinating and then screwing, then it is the supinator muscle, which is then supplied by radial nerve. So let us say a carpenter by occupation happened to be very well drunken, and then he went and fell down. And there is a fracture of his humerus in the last 1/3 of the humerus. So between middle 1/3 and last 1/3, what is there, doctor? You are having the radial canal through which the radial nerve is passing. So next day, this carpenter, when he goes back to work with this fracture of his middle and distal 1/3 junction fracture, where radial canal is involved and radial nerve is injured, supinator, which is supplied by radial nerve, doesn't work. But still, biceps brachii is supplied by the musculocutaneous will work. That's the reason this carpenter can be able to supinate when the elbow is flexed. He is able to supinate. But when the elbow is extended, he cannot be able to supinate, because when the elbow is extended, when you are supinating, you require supinator muscles is supplied by radial nerve, which is injured whenever there is any fracture of the humerus. One of the favorite clinical vignette, which you need to be very, very sure when you go to the tomorrow's NEETPG. Now, radial artery, where does it end? So you have a superficial palmar arch, deep palmar arch. It is a deep palmar arch. Radial artery ends in deep palmar arch is what you have to basically remember. So now, doctor, subacromial bursa in the shoulder. So what is the largest bursa in the body? The subacromial bursa in the shoulder is the largest bursa in the body. So which is the nerve of the brachial plexus passing very close to your medial epicondyle? Ulnar nerve is the one which you need to remember. So whenever there is any lateral condylar fracture, suppose lateral condyle fracture is there. So lateral epiphysis doesn't grow, but the medial side is still growing. So the person will go into cubitus valgus. And as a late complication, the ulnar nerve is being injured. That's called tardy ulnar palsy, which typically occur whenever there is any lateral condylar fracture of the humerus, is what you have to basically remember. And what is the contents of the anatomical snuff box, doctor? Radial artery is the content of the anatomical snuff box. Anatomical snuff box. And what is the boundaries, medial boundary of the anatomical snuff box? One of the favorite area of the examiner. It is the extensor pollicis brevis, the longest. Extensor pollicis longus is the medial boundary of the anatomical snuff box, is what you should remember. Now, whenever there is any anterior shoulder dislocation, what is the artery which is involved? Axillary artery is the one which is affected whenever anterior shoulder dislocation is there. There are few muscles that receive dual nerve supply, few muscles receive dual nerve supply. So, flexor digitorum profundus, it has got a ulnar half, radial half. So, you should know ulnar half is by ulnar nerve, whereas the radial half is by the median nerve, is the nerve supply. So, flexor digitorum profundus has a dual nerve supply, is what you have to remember. Sartorius, it is also called tailor muscle. So, whenever you happen to put your thigh on another thigh, cross-legged, then it is the sartorius which is very important. Sartorius originates from the anterior superior iliac spine, the origin of the supinata. I mean, the sartorius is a favorite question. What is the nerve that supplies tibialis posterior muscle? Tibialis posterior is supplied by the posterior tibial nerve. Posterior tibial nerve. Adductor canal, anatomy of adductor canal used to be a short answer question in our first year MBBS days. So, adductor canal lateral boundary is formed by vastus medialis. So, you know, vastus medialis, vastus intermedius, and vastus lateralis, semimembranosus, semitendinosus, biceps femoris. All this quadriceps group of muscles you should know. So, adductor canal's lateral boundary is formed by the vastus medialis, is what you need to remember. So, he will give an image-based question on the femoral triangle. You should know what is the base of the femoral triangle, what is the medial border, lateral border, floor of the femoral triangle, everything about the femoral triangle. So, in the floor, you have the iliacus muscle. So, you should know how to identify that in a image-based MCQ in the tomorrow's FMGE, NEETPG, and INICET exam. Biceps femoris. The biceps femoris is the one which is the one that lead to flexion of the knee joint is what you have to remember. So what is the chief extensor of the thigh at the level of the hip joint? At the level of the hip joint, it is the gluteus maximus. So because you need to remember, gluteus medius and minimus are abductors of the hip, whereas the gluteus maximus is the chief extensor of the thigh, and this gluteus maximus is supplied by inferior gluteal nerve, whereas the gluteus medius and minimus are supplied by superior gluteal nerve. You need to remember emphatically in the tomorrow's exam. So that's what I want to tell you. 22,000 PYQs, 10,000 PYQs of the NEETPG, 6,000 PYQs in FMGE, 6,000 PYQs in INICET. Totally, it will take around 200 hours, 200 hours for you to do at least one round of revision of these 22,000 PYQs. Everything we think, and seniors also misguide, saying that, no, PYQs are before exam. No. Before you start exam, when you are nothing, when you have a lot of gaps to fill, first thing you need to know is, what are the gaps in my knowledge level that I need to fill compared to what examiner is expecting and what is examiner want to ask you in the real exam. So how will you know what are your gaps? Only when you solve the 22,000 PYQs along with Dr. Murali Bharadwaj. Every day around 100 to 150 PYQs we finish. In about 150 to 200 hours मेरे साथ रहो और ये PYQs खत्म करेंगे. हर एक PYQ प्रीवियस ईयर क्वेश्चन को मैंने एक सिंगल लाइनर बनाया ताकि वो इजी बन जाए आपके लिए. और which topic does it belong to also I have classified. And then created a PDF of these 22,000 PYQs, and I'll provide you as a notes. And every day we'll have 150 to 200 PYQs revision, Monday to Thursday, and that will give you the real required essential energy for the tomorrow's NEETPG exam, doctor. No confusion. Aram se you can be able to top the entrance exam. So peroneus tertius muscle is a everter of the foot. Everter of the foot is what you need to remember. Popliteus muscle, what is the nerve supply? Supplied by the tibial nerve. Positive Trendelenburg's is because of the weakness of the gluteus medius and minimus, not maximus. Maximus is supplied by inferior gluteal nerve. Medius and minimus are supplied by superior gluteal nerve, is what you have to remember. So it is the gluteus medius and minimus muscles which are involved whenever there is Trendelenburg test positivity. Now, the capsule of the knee joint is very sensitive structure. It is the genicular branch of the obturator nerve. Genicular branch of the obturator nerve, which supplies the capsule of the knee joint, is what you have to remember. So there are certain bones which are not needed but still there. So fibula is the bone which is present in the lateral head of the gastrocnemius muscle, is what you have to remember. Now, in the intercostal space, in the lower rib of the lower border of the rib. That's the reason whenever you are doing any intercostal drainage needle or anything, you need to pass along the upper border of the rib, but not lower border of the rib. Please don't forget. So it is VAN, first vein, next artery, then nerve. Vein, artery, nerve. Vein, artery, nerve. VAN, from above to below, is what you have to basically remember. The 11th rib, किसको कहते हैं? Floating rib. 11th rib is called the floating rib. Now the xiphoid process. So the sternum is having a small chota tukda, which is called xiphoid process. Xiphoid process unites with the sternum, the body of the sternum. It takes around 40 years for it to become. By the time you become associate professor or professor of medicine, that time your xiphoid will unite. So what is tail of Spence? Tail of Spence passes through a foramen, named foramen called Langer's foramen. So once more, आप क्या कीजिए ना, you go back to the quick Google search or ChatGPT search. Tail of Spence क्या है, foramen of Langer क्या है, एक Google image देख लो. Definitely, this was a question that has been asked in FMGE, means it will come. Now, what is the lymphatic drainage of the breast? It is being given a name. Stapes plexus drains the breast is what you have to remember. Now, which part of the lung, which lobe of the lung is having a lingula? Lingula is the part of the left upper lobe of the lung. Once more, let me tell you, doctor, bronchopulmonary segments. Where does aspiration occur? Into which segment when you are lying down? Where will aspiration occur when you are sitting? Which bronchopulmonary segment typically has got lingula? All these things are the favorite questions of the examiner. Now, whenever you are doing a violent expiratory effort, then your extra ventilatory muscles will work. And what is the muscle which is very important for letting you to do a forced expiration? Latissimus dorsi is the one which is involved in the violent expiratory efforts. Now, there is a point which is called the watershed zone between the inferior mesenteric artery and the internal iliac artery. Inferior mesenteric artery and internal iliac artery. Isko kehte hain Sudex point is what you need to remember. So once more, doctor, aorta, branches, mesenteric artery, superior mesenteric artery, inferior mesenteric artery, what are the branches? External iliac artery, internal iliac artery, what are the branches? How many parts are there? Everything in anatomy, 1 MCQ out of 200 questions, sure shot in the vascular tree, one of the branches of the blood vessels. Their speciality के बारे में एग्जाम में कल के नीट पीजी में पूछा जाएगा. So where will portal vein form? It is a combination of splenic vein with mesenteric vein forms the portal vein. Portal vein typically starts at the level of the L2 vertebral level is what you have to remember. Now in the celiac artery branches, what is the smallest branch? It is the left gastric artery which is the smallest branch. So all the branches of the celiac artery, especially the pancreatico-duodenal artery, gastro-duodenal artery, so right side kahan se aayega, left side kahan se aayega, all these things you have to be very sure, doctor, for the tomorrow's exam. So extraocular muscles. Abducens supplies the lateral rectus. Abducens supplies the lateral rectus. Now, the blood supply of the spinal cord. How many spinal arteries are there, doctor? Remember, there is one anterior and two posterior spinal arteries which ultimately supply the blood supply to the spinal cord. Then anterior two-thirds of the spinal cord is supplied by the anterior spinal artery. Anterior spinal artery. Please don't forget the blood supply of the spinal cord is very, very important. So if you look the anencephaly, etc., you should know what is the embryological origin of those congenital anomalies of neural tube defects. It is the non-closure of the anterior neuropore, which typically is responsible for the neural tube defects. Now, what is the function of the biceps brachii? If you want to lift the forearm, the primary mover is always the biceps brachii is what you have to remember. So in leprosy, typically you get the claw deformity. It is because of what? It is the thickening of the ulnar nerve, involvement of the ulnar nerve that lead to the development of the clawing of the hand is what you have to remember. So where is the neurovascular bundle? It is in the anterior wall of the abdomen, and it typically lies between the internal oblique and the transverse abdominis. Internal oblique and transverse abdominis के बीच में anterior abdominal wall में you have the neurovascular bundle is what you have to remember. Now, midbrain. So you should know one important funda, Doctor. Yes. Typically, you have the midbrain. What is this called? Midbrain, brainstem में. Midbrain के बाद में होता है pons. Pons के बाद होता है medulla. And which is the cranial nucleus which is located in midbrain? Third, fourth. What is third? Oculomotor. Fourth, trochlear. They both are located in midbrain. Then fifth, sixth, seventh. Fifth, sixth, seventh. Fifth is trigeminal. Sixth is abducens. Seventh is facial. They are located in the pons, the cranial nuclei. Similarly, 8th, 9th, 10th, everything else is located in the medulla. So this brainstem may, which cranial nuclei at which level you need to be very sure. So any midbrain lesion will cause an injury of oculomotor and trochlear. Right? The only extraocular muscle is abducens, which supplies the lateral rectus, which is located in the pons is what you need to understand. And once more, what is medial longitudinal fasciculus? वो भी बताएंगे, right? So typically, if you take the midbrain and pons, so here you have the third this side and also third this side, right? Barabar. Then here you are having the sixth this side and also sixth this side. So let us say your eye, there are two eyes, right? There are two eyes. So whenever your eye is looking this side, what is it doing? It is abducting. Same time the other eye is supposed to undergo adduction. Then only conjugate horizontal gaze will occur. Let us say a beautiful curvaceous study mate is passing in the reading room. So suddenly from the Harrison's internal medicine, what will your eyes will do? They will abduct to look at that person. Same time the other eye should adduct. So how will that other eye will know? So basically the abducens in the pons, when it is looking at that curvaceous person, will inform with the help of a tract called medial longitudinal fasciculus. It will inform the third nerve, oculomotor of the other side, to also look at that person. That means to adduct, while this eye is abducting. Who will tell? First this eye have seen this curvaceous person, then it is abducting. So whenever it is abducting, the abducens will pass that information using the MLF to the other side's third cranial nerve and make it to get also adducted. That's the reason you will have a conjugate gaze. But if there is any multiple sclerosis like condition where this medial longitudinal fasciculus क्या हो गया? Demyelinate हो गया. If it got demyelinated, what will happen, doctor? The third cranial nerve doesn't know that the other side's abducens is working bolke. That's the reason when this is abducting the eye, the other eye won't adduct, and that is called adductor lag. Adductor lag. And which side is the MLF involved? the side where there is a adductor gland, whereas the other eye already abducted. That's the reason there is a diplopia, double image. And immediately the abducting eye will come back into nystagmus. So the MLF lesion is not on the side of nystagmus eye. It is on the side of adductor lag is what you have to remember. And this condition is called internuclear ophthalmoplegia. So what are the two nuclei involved here? One is the sixth cranial nerve, other is the third cranial nerve, is what you have to basically remember. All right, doctor, clear? So, रोज पढ़ेंगे, रोज मिलेंगे, एक दिन कामयाब होके दुनिया को बताएंगे भाई 22,000 PYQs. Bite to bite, I finished revision with Dr. Murali Bharadwaj. Automatically, you will get the seat. All right, doctor. So please take opportunity to go to our web portal, playscore.live. Playscore.live is our website. So here you have all the details, right? So we have 3 types of packages. One is called video library, where there are 400 hours of video content, totally 5,000 short videos covering all the 20 subjects, which is made available on the website, onlinembbs.com. Same time, all these classes which I am now delivering, 200 hours of PYQ revision of the 22,000 PYQs is there, no? That also become archived onto our web portal. All right. So that is being offered for a small throwaway price of 6,000 rupees. Similarly, every Friday, Saturday, we have a subject-wise mock test and discussion according to a schedule. 50 subject-wise mock tests and discussion, and every Sunday, full-scale grand test and discussion. Right? So that is being offered totally 26 Sunday full-scale grand test discussions and 50 subject-wise mock tests and discussions for around 6,000 rupees. And then we also provide the notes of around 70,000 high-yield facts as single liners, and also 5,000 clinical case minutes, which are frequently tested. Similarly, 3,000 image-based MCQs. All these as a notes we provide for a small throwaway price of 6,000 rupees. So today only, please visit playscore.live, and you are also having the WhatsApp number, right? The WhatsApp number. You can call our helpline and they will help you to get admitted. So, doctor, after that short advertisement, let's go to the next important point. Whatever, already we finished 52 points. Postauricular muscle, it is attached to temporal bone. Ipsilateral deviation of the tongue occur because of the genioglossus muscle. So you should know hypoglossal nerve, right? What is the motor supply of the tongue? What will happen whenever the hypoglossal nerve paralysis occur? You need to be very, very sure. Now, arteria thyroidea ima, the blood supply of the thyroid. So it originates from the arch of aorta. So once more, it is a small short note. You need to know what is arteria thyroidea ima, what are the blood supply which is contributing to the formation of this plexus, vascular plexus, right? So the arch of aorta. Now, where is the thyroid gland? Thyroid gland is situated at the level of T5 to T1. So there are 20 anatomical landmarks which you need to mug. Ratta maro, batti maro, kuch bhi karo. But you need to remember this 20 anatomical landmarks. Every entrance book will give you that. Entrance notes of any coaching center will give you that. But it is up to you to remember, reproduce and replace in the tomorrow's exam. How many lobes are there in cerebellum, doctor? It has 6 lobes. Of all, what is the smallest lobe of the cerebellum? It is the flocculonodular lobe, which is the smallest. Now, the subclavian artery has Part 1, Part 2, Part 3. Vertebral artery typically is derived from the first part of the subclavian artery. That's what you need to remember. Once more, you should be very sure, doctor, the circle of Willis, many times asked in the exam. Circle of Willis. So the two vertebral arteries combine to form basilar artery. So this is a vertebral artery, this is a vertebral artery, it will form basilar artery. Basilar artery divides into posterior cerebral artery. So this is a posterior cerebral artery, this is a posterior cerebral artery. And then here the internal carotid artery gives rise to the middle cerebral artery and also to the anterior cerebral artery. And the two anterior cerebral arteries are connected by anterior communicating artery. Whereas the posterior cerebral artery is connected to the anterior circulation through posterior communicating artery. Posterior cerebral artery is connected to anterior circulation, middle cerebral artery and anterior cerebral artery through posterior communicating artery. So this is the level where midbrain is giving the oculomotor nerve. That's the reason any aneurysm of the PYQs, posterior communicating artery, will cause the compression of the oculomotor nerve. Oculomotor nerve is what you have to basically remember. Right, doctor? Then once more, the vertebral artery and the basilar artery. So the midbrain, pons and medulla. So you are having the brainstem, lateral view I am giving you. Behind that you are having the vascular tree, which is the basilar artery that supplies the entire brainstem. Entire brainstem. And here you have PYQ and ICA, posterior inferior cerebral artery and anterior inferior cerebellar artery. These two originate from the vertebral and basilar. Vertebral and basilar will give rise to ICA and PYQ. They are the ones which supply the cerebellum. So any lesion of the PYQ will cause in the medulla, the lower part of the brainstem, there is a lateral medulla, medial medulla. So the lateral medullary syndrome is because of the occlusion of the PYQ, which is originating from the vertebro-basilar system, is what you need to remember. And that is called lateral medullary syndrome of Wellenberg, is the name which is being given to that. So that is the story which you have to be emphatically sure for the tomorrow's exam. So now, doctor, dorsal scapular artery. It is the branch of the third part of subclavian. Vertebral is first part of the subclavian. So today only you need to go back. All the subclavian, first part, second part, third part, what are the branches from each of them? Invariably you need to remember, if you don't PYQs, if you dishonor the PYQs, the direction shown by the PYQs, gone, right? So that is very, very important. Now, doctor, anterior inferior cerebellar artery, ICA, is a branch of basilar artery, is what you have to remember. Ascending pharyngeal artery, you should know external carotid, internal carotid. Internal carotid does not give any branches in the neck, only external carotid gives. External carotid ultimately terminates into ascending pharyngeal artery, which is the smallest branch of the external carotid artery. So once more today only you need to go back and look at in your notes whether you are ready with all the branches of the external carotid. Maxillary artery, right? Facial artery. So maxillary artery may first part, second part, third part, what are the branches of each of them? Oh, you need to master it and internalize, doctor. Any number of coaching programs are useless unless you make a will that I'm going to master these 22,000 PYQs. I am going to make a definitive stand on what to be remembered, mugged and repeated before the exam. 4 months Dr. Murli Bharadwaj ke saath safar karo. I promise you, top 100 में आप निकलोगे. Right, doctor? Now, subarachnoid space, it extends up to the lower border of the S2 is the anatomical level where subarachnoid space will be extending. So cranial nerve 3, what are all the cranial nerves that carry parasympathetic nerves, doctor? 3rd, 7th, 10th. 10th is vagus, one of the major parasympathetic supply to the heart, gut, peristalsis, everything is vagus. Similarly, cranial nerve 3, oculomotor nerve will be carrying the parasympathetic fibers, which typically supply the sphincter pupillae. So pupillary constriction is due to the parasympathetic innervation carried by the oculomotor, dropped at the ciliary ganglion, supplying the sphincter pupillae is what you need to basically remember. Now, doctor, cranial nerve 8 is vestibulocochlear. It will listen, it will balance you. It is pure sensory nerve. So what are leptomeninges? Arachnoid and pia. So there is a dura, arachnoid, pia. Pia is the one which is directly abutting the brain. So arachnoid and pia are called leptomeninges. So temporal lobe is separated from frontoparietal. Frontoparietal is a little higher level. By what? Sylvian fissure is what you need to remember. Sylvian fissure. So whenever you look at the CT scan, any bleeding stagnating in the Sylvian fissure means it is a subarachnoid hemorrhage ka diagnosis ka very important imaging finding is what you need to remember. Now, how is superior vena cava is formed? It is the fusion of the left and right brachiocephalic veins. Left and right brachiocephalic veins combined to form SVC along with IVC will be draining into right atrium is what you have to remember. So what type of joint is a temporomandibular joint? It is called bicondylar joint is the name given. So different types of joints, example of one for all that, saddle joint, right? Bicondylar joint, all these types of joints, one example, what type of movements occur at each of these joints? Pivot joint, saddle joint, bicondylar joint. So what type of movement occur? Ek table rehta hai, you need to be very sure about it, doctor. Now, foramen rotundum. So all these foramina, which nerve passes through them is a favorite question. Rotomax is the pen company. Rotomax. Foramen rotundum typically transmits the maxillary nerve is what you have to basically remember. Foramen transversorium typically is found in the cervical vertebrae through which the vertebral artery will be passing. Foramen transversorium is what you need to remember. So what is nerve of Risberg? So from the anterior 2/3 of the tongue, the nerve supply typically is carried by the nerve of Risberg is what you have to basically remember. So glossopharyngeal, chorda tympani, which part of the tongue taste is carried by which nerve is a favorite question of the examiner. Now, limbic system, the other day I told you, Pepys circuit, mammillary bodies, amygdala, fornix, everything is a favorite area of examiner. If you look at the FMGE question bank, every time they keep asking about the limbic system. So, cingulate gyrus, gyri, sulci. Sulci are the depressions, gyri are the elevations. It is the cingulate gyrus which is the part of the limbic system is what you need to remember. So, what is nucleus ambiguous? So, there are two things that you need to know, doctor. In the brain stem, precisely speaking, right? In the brain stem, you have some of the nuclei which are called motor nuclei and sensory nuclei. In that, you need to know two important nuclei. Nucleus ambiguous. Nucleus ambiguous. बच्चों, nucleus ambiguous is a common motor nucleus of 9th, 10th and 11th cranial nerves. 9th, 10th, 11th glossopharyngeal, vagus and 11th cranial nerve ka nucleus ambiguous is a motor nuclear complex. Whereas nucleus tractus solitarius, इसको कहते हैं NTS. It is a sensory nucleus. Sensory nucleus of which cranial nerve? N for 9th, T for 10th, S for 7th, 7th, 10th, 9th. For this, the common sensory nucleus को क्या कहते हैं? Nucleus tractus solitarius is what you need to basically remember. So, doctor, optic nerve is the second cranial nerve. And what are the contents of the Alcock's canal? Wow. So, doctor, tomorrow, when you become an ophthalmologist, you don't require Alcock's canal. But for becoming cardiologist, cardiovascular surgeon, still you need to clear entrance exams. For that, you need to remember Alcock's canal transmits the pudendal nerve. So, pudendal के बाद सुनते ही हमको क्या याद आएगा? Genital organs. So, pudendal nerve passes through Alcock's. So, vitelline duct, vitelline vessels, allantois, they all will obliterate in the fetal life. Once more, you need to know what are the embryonic structure and their counterparts in the adults. एक table होता है, हर एक PG entrance book में मिलता है, मगर you need to master it somehow. Now, typically, if you look at the diaphragmatic openings, voice of America, what is that, doctor? Voice of America is what you need to remember. VOA. Vena-cable opening, esophageal opening, aortic opening. The third is aortic opening. So in this is at the level of the T8, this is at the level of the T10, this is at the level of the T12. So you already know what are their levels. And what passes through them also you should know. Definitely vena cava, esophagus and aorta. In addition to that, what else will pass also you should know. Right? So now the question of the examiner is thoda ajeeb question hai. In this, which will contract every time diaphragm is contracting? There are the openings in the diaphragm, right? So esophageal opening constrict with the diaphragm. Aortic opening constricts with the diaphragm, but not the vena-cable opening is what you need to remember. So what is the nerve supply of the soleus muscle, doctor? Tibial nerve is the one which supplies the soleus muscle. So I say single liners definitely asked previously means aur ek baar bhi examiner पूछेगा. But we need to remember there are so many muscles. Everything you can't remember, no, at least those which are asked you should remember. So what is iliotibial tract? Iliotibial tract is a thickening of the fasciolata. Fasciolata is what you have to remember. Gluteus maximus. Gluteus maximus is the primary extensor, right? Extensor. Medius minimus are abductors of the hip. So because it's an extensor, it is responsible for the sitting to standing position for a person to raise is what you have to understand. Posterior superior iliac spine. What is the anatomical level of it, doctor? S2 is the level at which posterior superior iliac spine is present. Coccyx has how many vertebrae? 4 vertebrae. Now, you should know each of the branchial arches and what are their derivatives. So you have a greater cornu of hyoid, lesser cornu of hyoid. Lesser cornu of hyoid comes from second branchial arch. second branchial arch. So tomorrow exam, if you try to guess which branchial arch, यार अरे मैं तो पूरा confused हो गया यार. Confused कुछ भी नहीं होता. Only innocence, maasumiyat, right? Now, doctor, superior portion of the hyoid bone is derived from the second branchial arch. Second branchial arch, and the auricle develops from the first and second branchial arch. So each of these branchial arch and their derivatives, what is their nerve supply, what are the muscles associated, everything. Branchial arch derivatives का मामले में अगर wrong किया तो 20,000 people will cross you and move forward, right, doctor? Now, spermatogenesis. How many days does it take for the sperm to prepare for the NEETPG exam? 74 days is what you need to. 74. It is not days. Is it days or hours? We will check. Right? There's a small error. Now, of all the spermatogenic cells, it is the primary spermatocyte which has the largest size among the spermatogenic cells is what you need to remember. So, yeah, it is days only, doctor. Spermatogonium to spermatozoon transformation takes place in 74 days. And which part of the male genital tract will sperm acquire the motility, doctor? Epididymis. Epididymis is like internship period, where sperm acquires the motility in epididymis. Now, when will the embryo begins to implant in the endometrium? So what is the stage? It is the blastocyst stage at which the implantation occurs. So in the embryology, you should know the timelines of the various events in the fetal development. When will heart beat start, when will lungs start functioning, etc., etc., etc. Now, embryo is a term that you will use until how long? How long after fertilization? Up to 8 weeks. 2 महीने तक इसको कहते हैं embryo. Fetal stage, when do you call? From the 8th week of gestation. Up to 8th week embryo बाद में होता है. Fetal stage is what you need to understand. So you are having foregut, midgut, hindgut. Foregut is until second part of the duodenum, sample of Vater. From the second part of the duodenum starts the midgut, right? So inferior mesenteric artery is the one which mainly supplies the midgut, right? And superior mesenteric, which supplies the hindgut, and midgut is supplied by the superior mesenteric artery, is what you need to ultimately remember. So all the neural crest cell derivatives, एक लिस्ट बनता है, वो लिस्ट को आप गर्मा गर्म रिविजन करके एग्जाम के लिए तैयारी करना है. So doctor, you should remember that adrenal medulla is derived from neural crest. Germ cells are developed from yolk sac. Hyoid bone को कितने ossification centers हैं? अगर एक बार भी ये fact नहीं पढ़े तो how will you remember? How will you guess in exam? Right? 6 ossification centers is the hyoid bone. From where does the trigone of the urinary bladder develop? It also develops from the mesoderm. Umbilical artery में कितने arteries, doctor? 2 arteries, 1 vein are the part of the umbilical artery. And it is the Leydig cells which produce testosterone. Leydig cells are under the influence of luteinizing hormone. And when luteinizing hormone tells them, they produce the testosterone is produced by Leydig cells. Then gallbladder, what type of epithelium, doctor? It is brush-bordered, columnar epithelium is the one which supplies, which lines the gallbladder. So where do you find Hazel's corpuscles? So histology of thymus, spleen, lymph node. Thymus, spleen, lymph node. You must know very well. Today only you need to go back and do the revision, doctor. So thymus में होता है Hazel's corpuscles. Once more, You need to go back to Google Images and check Hazel's corpuscles. How do they look like? So tomorrow image-based questions typically come from this kind of high-yield facts. So where do you see Malpighian corpuscles? Malpighian corpuscles are seen in the kidney. Cord of Billroth is seen in spleen. T cells are derived from thymus. And how does ulnar nerve pass? Ulnar nerve does not pass deep to flexor retinaculum. It passes superficial to flexor retinaculum. That's why anybody tries a wrist cut, right, to show off to his girlfriend, it is the ulnar nerve that is going to be damaged. So what is the root value of axillary nerve? C5, C6 is the root value. And brachial plexus में lateral cord, medial cord, right? So lateral cord से निकलता है LML, 3 nerves, LML from the lateral cord. Musculocutaneous arise from the lateral cord. Lateral cutaneous nerve of forearm arise from lateral cord is what you should remember. And what is the root value of the radial nerve, doctor? C5, C6, C7, C8, T1. C5, C6, C7, C8, T1. Everything will contribute for the radial nerve is what you need to understand. Now the winging of the scapula. Winging of the scapula, latissimus dorsi, is the long thoracic nerve of the bell, which is typically damaged, leading to, the winging of the scapula due to the serratus anterior is because of the long thoracic nerve of the bell is what you have to ultimately remember. Then it is the trapezius whose paralysis will lead to drooping of the shoulder, the trapezius. And a pointing finger, whenever you happen to make a fist, then one finger cannot be able to flex, it remains pointed. That is a feature of the median nerve injury. And the claw hand is because of both the median and also ulnar nerve injuries. Any of them can lead to the development of the clawing of the hand. A thumb deformity is due to the median nerve injury. And carpal tunnel syndrome में किसका compression होता है? Median nerve. Median nerve supplies thumb, index and half of the middle finger. Sensory supply is all by the median nerve is what you should remember. Now, whenever there is a rotator cuff tear in the sports injuries, what is the most common muscle of the rotator cuff which is injured? It is the supraspinatus, right? Supraspinatus. So you should know SITS group of muscles: supraspinatus, infraspinatus, teres minor, right? So supraspinatus is most commonly injured. So which muscle is the one which prevents the inferior dislocation of the glenohumeral joint? So it is the coracobrachialis, which is the one which is preventing the downward dislocation of the glenohumeral joint. Now, if you look at the biceps is innervated by the musculocutaneous nerve, whereas supinator muscle is innervated by the radial nerve. Just before we have discussed one of the favorite questions of the examiner. The long head of the triceps brachii, the long head of the triceps, piche, supplies both the shoulder and also the elbow is what you need to remember. So what type of muscle is the deltoid? Deltoid is a multipinnate muscle. So all examples of multipinnate and unipinnate muscles you should know. Fracture of the shaft of the humerus typically injures the radial nerve in the radial groove is a favorite topic of the examiner. So where are the level 3 axillary lymph nodes located, doctor? Typically pectoralis major, minor, superior to the pectoralis minor, you have the level 3 axillary group of lymph nodes. Once more, level 1, level 2, level 3 क्या होता है axillary lymph nodes में? That should be your quest and a mastery which is required for the tomorrow's NEETPG. 22,000 PYQs must make you to look for another 50,000 PYQs, I mean prospective questions. That's how a 70,000 हाई यील्ड फैक्ट्स को मैंने नोट्स बना के सिंगल लाइनर के फॉर्मेट में सब्जेक्ट वाइज आपको दे दूंगा. Once you join and subscribe to our regular coaching program. Now, supination and pronation typically occur at the level of the radio-ulnar joint at the superior part of the radius is what you have to remember. Now, the cubital fossa. The cubital fossa is very important. The medial border of the cubital fossa is formed by the prunita teres, and median nerve passes very close to the prunita teres. प्रोनेटा टीवी से गुहा बनाएगा, वो गुहा के अंदर से जाएगा मीडियन नर्व. सो मीडियन नर्व इंजरी इज वेरी कॉमन इन प्रोनेटा टीवीस. इट कैन अंडरगो द compression is what you need to remember. Now the femoral nerve, what is the root value? L2, L3, L4. L2, L3, L4 is the femoral nerve. There is no other way. भजन करना, एक दो साथी के साथ बैठना, 22,000 PYQs which I give you the PDF. Revision karna in the form of single liners. Mark karna the points which you are supposed to revise once more for the exam. All points are not required to be revised once more before exam. Right, doctor? Now, gluteus maximus. It is inserted onto the iliotibial tract. Sartorius is the longest muscle of the body. Longest. सबसे लंबू क्या होता है? sartorius. Rectus femoris typically attaches on the capsule of the hip joint. Capsule of the hip joint. Semimembranosus, semitendinosus. So what constitutes the hamstrings? You need to be very sure about. And it is a superior gluteal nerve that supplies the gluteus, medius and minimus, whereas inferior gluteal nerve is the one which supplies the gluteus maximus. And gemellus inferior, very important muscle. Naru supply is a favorite question of the examiner. Naru to quadratus femoris. Naru to quadratus femoris is the one which supplies the gemellus inferior is what you should remember. Quadriceps femoris is the main extensor of the knee joint. Main extensor of the knee joint. Similarly, at the level of the hip joint, it is the gluteus maximus which is the main extensor is what you should remember. And the unlocking of the knee joint, unlocking whenever you are flexing and extending the knee, unlocking of the knee joint is typically due to the popliteus muscle is what you should remember. Tell me the bone, the only bone which has no muscle attachment. It is like Gautam Buddha. Attachment brings sorrow, no attachment is the happiest state of life. Talus bone has no muscle attachment is what you should remember. And fibular neck injury typically leads to the fibular neck injury leads to common peroneal nerve injury is what you should remember. Common peroneal nerve injury. Now once more, Hasselbalch's triangle. You should know what are the boundaries of it. It is the linea semilunaris which forms the medial border of the Hasselbalch's triangle is what you should remember. Now, inferior border of the Hasselbalch's triangle, Paupert's ligament forms the inferior border of the Hasselbalch's triangle. Now, what is the root value of the superior gluteal nerve, doc? Which supplies gluteus medius and minimus, which is the main abductor of the hip joint. Superior gluteal nerve is typically supplied by, originate from L4, L5 and S1. And posterior cutaneous nerve of the thigh, S2, S3, S4 is the root value. Sciatic nerve, L4, L5, S1, S2, S3 is the root value. Pudendal nerve, S2, S3, S4 is the root value. So all this chota mota cheeze, you need to pop in and then be ready for the exam. The base of the heart. So remember, always in the heart, the right-sided chambers are anterior, left-sided chambers are more posterior. So in that, most high is left atrium. So left atrium forms majorly the base of the heart is what you need to basically remember. Then when the heart comes down, you see the apex. So the base is mainly formed by the left atrium, which is most posterior chamber. Right ventricle, most anterior chamber. Whenever the steering wheel while driving hits and there is any fracture of the sternum, it is the right ventricle which is affected the most is what you need to understand. So what is the length of the trachea, doctor? Length of the trachea hota hai 10 centimeters. 10 centimeters. So a lot of you are going to do tracheostomies. You are going to pass endotracheal tube. So you need to know the anatomy. The diameter of the trachea hota hai 2 centimeters. Most commonly, foreign body is typically large. Whenever fish bone or something lodges, where does it lodge? So there are some constrictions for the esophagus. So where the arch of aorta crosses the esophagus, you have the aortic constriction where the foreign bodies get typically lodged. So respiration, we do respiration. 75% of the respiration is contributed by the diaphragmatic activity. And the motor supply of the diaphragm is phrenic nerve, all of you know. Intercostal veins, typically, they all drain into the azygous vein. Once more, azygous vein typically forms a notch in the lung, mediastinal surface of the lung. Please don't forget. Already we discussed that point. So they have given duodenum, jejunum, ileum, everything, and jejunum has certain radiological features that makes it distinct, and given as an image-based question to identify the jejunum is what you should remember. So, doctor, that brings us to the end of 150 to 300th PYQs. Totally 6,000 PYQs are there in the last 10 years of FMGE. Excellent question bank, right? From which once more recurrence of questions will come. All right. And following that, we will have 10,000 NEETPG PYQs in this kind of single liner format. Wherever it requires explanation, discussion, I will go to the whiteboard and discuss with you. So 22,000 PYQs we will finish in a span of 200 hours in the next 4 months, right? And this is the one which is going to help you. Monday to Thursday, we have the PYQ discussion. Friday, Saturday, we have the subject-wise mock test and discussion. Every Sunday, we have a full-scale grand test and discussion. Like that, 6 mahine mere saath chalo. I will hold your hand and show you how to become the topper in the NEETPG. And please don't forget, doctor, to visit today only playscore.live, our web portal, playscore.live, playscore.live, right? So in that you have the video library, NEETPG mock test, notes, subscription. We will offer you that. And you also have our helpline numbers that you can connect in order to subscribe to our program. In addition to this, whether you are a mock test series student or whether you are a video library student or whether you are a notes student, every day there is a free class, evening, 1 to 1.5 hours with Dr. Murali Bharadwaj, daily live. After a couple of days, we start removing this video after the broadcast and we will be archiving it into our video library. Okay, so thank you very much and we will once more see tomorrow. Please don't forget to like this video, share this video and tell all your friends in all the social media groups that Dr. Murali Bharadwaj sir के साथ NEETPG preparation, east or west, that is the best option. All right. So good night, doctor. Enjoy a great time.